Hello all, welcome back to the channel. Today we'll discuss the guidelines related to the anesthesia section. Let's move on to the topic. So, what is anesthesia? We can split the term into two, that is prefix and suffix, right? An means without or absence of. Anesthesia means sensation, right? So here, what is anesthesia? Absence of sensation. That is the meaning for the term anesthesia. During surgery, we are able to feel the sensation of pain, right? So in order to block the perception of pain, we use anesthesia in medicine. I hope you are clear with the definition of anesthesia. Next, we'll see the types of anesthesia. We have general anesthesia, regional anesthesia, MAC, that is monitored anesthesia care, local anesthesia, and sedation. So, first, general anesthesia. This is the most common form of anesthesia for major surgeries. The patient is fully unconscious and completely unaware of what is happening. It is typically used for invasive procedures. So, how will you identify the general anesthesia? Sometimes it will be mentioned in the medical record clearly as general anesthesia. If it is not mentioned, we can identify the type of anesthesia by looking the components used during the surgery. For example, ET tube placement, TIVA, LMA, or oral airway. If these terms are mentioned means then it is general anesthesia. So, ET tube placement, that is endotracheal tube placement, LMA, laryngeal mask airway, or TIVA, transintravenous anesthesia. If these terms are mentioned means that is general anesthesia. Second, regional anesthesia. Regional anesthesia is used to numb specific part of the body or region. For example, if you are going to perform a knee surgery, then we'll block the leg area only. So, to block a specific region, we'll be using regional anesthesia. Regional anesthesia can be divided into two, that is central and peripheral. During regional anesthesia, the patient may remain awake but they can't able to feel pain in the targeted region. So what is the difference between general and regional means? In general, whole body will be sedated. In regional anesthesia, only a specific region will be sedated. So as we have discussed earlier, regional can be divided into central and peripheral, right? So central can be further divided into two, that is spinal and epidural. So spinal anesthesia is used for knee or hip surgeries. We are using epidural for labor. Next is peripheral. Under peripheral we'll be having the nerve blocks. So what is peripheral regional anesthesia? It refers to the use of local anesthetics to block nerve at specific sites which is outside of the central nervous system. So peripheral regional anesthesia is often used for surgeries on limbs, brachial plexus, femoral nerve block, sciatic nerve block, infraclavicular block. These are some examples of the peripheral nerve blocks. Next, MAC, that is monitored anesthesia care. It is a type of sedation where the patient is deeply relaxed and may be sedated but does not lose consciousness entirely. So here monitored anesthesia care. The term itself indicates monitored, right? So the anesthesia provider is responsible for monitoring the patient's vital signs throughout the surgery. We can able to adjust the sedation level and ensuring that the patient stays comfortable throughout the procedure. The patient will be in light sleep only. MAC can be used for some procedures, that is minor procedures. For example, colonoscopy, endoscopies, minor surgeries. These are some examples of monitored anesthesia care. Next, moderate sedation is also called as conscious sedation or MCS, that is moderate conscious sedation. Sedative technique where the patient remains awake and alert. The patient can able to respond to the verbal commands and physical stimulation but typically don't experience pain or discomfort during the procedure. So during the moderate sedation, the patient is conscious but sedated enough to tolerate the procedure. Here no deep sedation is involved and the patient can able to maintain their own airway and can able to respond to the commands. So moderate sedation is used for some procedures like dental procedures, certain minor diagnostic procedures like biopsies and skin excision procedures. Moderate sedation is coded separately from anesthesia based on the time spent and the complexity of the procedure. So, moderate conscious sedation will be coded by using the codes ranges from 99151 to 99157. Next is local anesthesia. Local anesthesia involves numbing a small area of the body where a procedure is being performed. The patient remains fully awake and aware. It prevents the patient from feeling pain in that localized region. So it is called as local anesthesia. It does not require the presence of an anesthesiologist or CRNA for monitoring, and local anesthesia is not billable separately. Local anesthesia is used for the following procedures, that is dental work like dental filling or tooth extractions, minor skin excision procedures or biopsy procedures. That's all about today's session. We'll discuss anesthesia guidelines in the next session. Thank you. Bye bye.